Hello friends, let us now learn some important points about intravenous urogram. Intravenous urogram is, is a radiological examination of the urinary tract, that is starting from renal parenchyma, calyces and pelvis. So it helps in radiological investigation of renal parenchyma, and we can also know about these are calyces and also about the pelvis. So this intravenous urogram is done by the injection of contrast media. The contrast media is injected intravenously to the patient, and then based on the flow, and then a series of X-rays are taken, and based on the flow of medium, the contrast will move from the blood vessels to the renal parenchyma whenever it gets filtrated in the next nephrons, and it goes into the calyces and pelvis. On doing serial X-rays, we can assess the renal parenchyma, calyces and pelvis. Then there is one more entity called as intravenous pyelography. Intravenous pyelogram. Intravenous pyelogram is actually visualization of pelvis, calyces, but not the renal parenchyma. This will not help in visualization of renal parenchyma, but we can visualize the calyces and pelvis with the help of intravenous urogram. So pelvis and calyces are visualized in intravenous pyelography, whereas in intravenous urogram, both renal parenchyma, calyces and pelvis can be visualized. Followed by, we also have one more thing which is called as pyelogram. This pyelogram, this pyelogram is reserved for retrograde studies. It is actually reserved for retrograde studies. So this pyelogram is mainly used for visualizing the collecting system. With the help of pyelogram, we can visualize the collecting system mainly. So it is used for visualizing collecting system, and it is a retrograde study. Then now, recently, if you see, there is decrease in use of intravenous urogram. Why? Use of intravenous urogram is decreased in recent days because of the availability of newer imaging modalities like CT and ultrasound can be used for assessing the um, renal system and collecting system. Because of that, CT and ultrasound, especially ultrasound, is non-invasive, and CT is also non-invasive. Ultrasound does not even expose the patient to harmful radiation. So, as a result, the CT and ultrasound are used prior to intravenous urogram in assessing the pelvic calyceal system and the urinary tract. It is also due to cost. Intravenous urogram is more costly when compared to ultrasound, and also there is injection of contrast media is done in intravenous urogram, and this injection of contrast media will result in side effects or adverse effects, and as a result the intravenous urogram usage is declined in recent days. Then, when do you use this intravenous urogram? What are the indications of intravenous urogram? Intravenous urogram is used in adults and also in children. So, especially if you see in adults, it is mainly used for screening in adults. Whenever a patient presents with either hematuria, or if the patient presents with pyuria, pus in urine, or blood in urine, in such cases, in order to screen the entire urinary tract, because with the help of this urogram, we will know the abnormalities of renal parenchyma, calyces, and also pelvis, and even the contrast goes into the ureter and bladder can also be assessed. So, as a result, screening whenever the patient presents with hematuria and pyuria can be done with intravenous urography. Similarly, if the patient presents with any disease of renal collecting system, and also if the patient has any disease of renal pelvis, any disease of renal collecting system and renal pelvis will help in for this we can use the intravenous urogram also. Then if you have to know the functioning of the kidney, the functioning of the kidneys can also, of both the kidneys, can also be assessed with the help of intravenous urogram. Functioning of both the kidneys is assessed with intravenous urogram. And then abnormalities of ureter. If there is any abnormality of ureter, that can also be assessed with the help of intravenous urogram. Then, in case of obstructive uropathy, in obstructive uropathy, that is, whenever there is some obstruction to the pelvic calyceal system or to the ureter or in the PU junction, pelvic junction, whenever there is obstruction. So, for obstruction, the intravenous urogram is actually gold standard, because if there is an obstruction, then obviously the contrast will pass up to the obstruction, but it will not pass distally. So as a result, the obstruction can be clearly visualized, and the location of obstruction and the site of obstruction can also be found out with the help of intravenous urography. If the patient has TB of urinary tract, then the changes that occur can also be visualized in intravenous urogram. Then, if the patient suffers from any calculous disease, these can be diagnosed, and functioning of the kidney can be assessed with the help of intravenous urogram. So, if the person is a potential renal donor or not, that is, whether the kidneys are functioning properly or not, in order to classify the patient as a good renal donor, we can do intravenous pyelogram. Similarly, if there is any surgery, that is before the any endourological procedures, any urological procedures that the patient can go into, or if the patient undergoes any type of surgery of urinary tract, in such cases we can do intravenous urogram. Then, if you suspect any renal injury, whenever there is any renal injury, there can be injury to urethra or injury to ureter or urinary bladder. In such cases, the contrast spills outside into the pelvis, and thus we can find whether there is injury or not. If there is no spilling of contrast, definitely the ureter is normal and there is no injury. Then, if the patient suffers from any type of renal colic, or in case of any flank pain, also we can do intravenous urogram to assess the condition of the patient. Similarly, there are some indications in children also. In children, if the child is suffering from water abnormalities, in water anomalies, actually, V for vertebral anomalies, or A for anal anomalies, B for tracheoesophageal fistula, R for any renal anomalies. These renal anomalies can be screened using this intravenous urogram. If the patient suffers from any malformations, especially polycystic kidney disease, or if the patient has any pelvic junction obstruction, then obviously in obstruction the contrast goes till the obstruction, but it will not pass distally, and as a result the site and location of obstruction can be clearly identified with intravenous urogram. Neurological disorders some of the neurological disorders which are affecting the urinary tract can also be diagnosed with the help of this intravenous urogram. Then, next, if the patient suffers from enuresis, and if you wanted to know the cause of enuresis in the presence of bacteriuria, or in if the patient has any history of recurrent urinary tract infections, in such cases we can do intravenous pyelogram and can be found out. Then, if the patient has any ectopic ureter, then the site of insertion of ureter can be found out with intravenous pyelogram. Or if there is any anorectal anomalies, or one important thing is if the patient has UTI. If the patient has UTI, first and foremost, we should do voiding cystourethropy is done, or micturating cystourethrogram is done. So if you do a voiding cystourethrogram and if it reveals any reflex only, then we can do intravenous pyelogram. But we generally do not do intravenous pyelogram for the evaluation of urinary tract infections directly. Then, what are the contraindications of intravenous urography? Intravenous urography is not used if the patient has any iodine sensitivity, or if the patient is pregnant, then there can be issues with contrast, or if the patient has severe history of anaphylaxis. In such cases, we do not do intravenous pyelography. So this is about intravenous pyelography. Thank you.